Temple ISD, let's talk about the COVID-19 vaccine. Is it safe? Is it effective? Who can get it? These and so many more are the questions that are on everyone's mind right now. School districts are not medical experts, but from the beginning of the pandemic, Temple ISD has worked closely with the Bell County Health Department to ensure that we provide timely and accurate health and safety information to our students, staff, families, and community. Through our expanded partnership with the Bell County Health District, we have collaborated to produce a video that seeks to answer some of your questions about the COVID-19 vaccine. This video is being distributed by the Bell County Health District across the county to inform stakeholders. Our goal in Temple ISD is to provide you with the most relevant, timely, and accurate information we have on all matters related to health and safety so that you can make informed decisions as parents, students, staff members, and members of the Temple community. Please take a few minutes to watch this video collaboration.
Since the start of the pandemic, the Bell County Health District has worked closely with school districts and other entities to provide accurate and timely information to stakeholders on safety measures and protocols related to COVID-19. As we begin to receive and administer COVID-19 vaccines across the county, we want to make sure that our citizens remain informed. The purpose of this video is to provide answers to the questions that are frequently asked about the vaccine so that stakeholders can make informed decisions based on the facts as we know them. Let's get started. Different types of vaccines work in different ways to offer protection, but every type of vaccine works by teaching our bodies how to make cells that trigger an immune response. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. COVID-19 vaccines do not use the live virus and cannot give you COVID-19. The vaccine does not alter your DNA. COVID-19 vaccination will help protect you by creating an immune response without having to experience sickness. There are currently two types of vaccines that have been approved for emergency use, Pfizer and Moderna. Both of these vaccines are based on the same mRNA technology. Both vaccines require 2 doses. The main difference between the two vaccines is that the second dose for Pfizer is given after 3 weeks and second dose of Moderna is given after 4 weeks. The other main difference is how they have to be stored. Safety is a top priority. The new COVID-19 vaccines have been evaluated in tens of thousands of volunteers during clinical trials. The vaccines are only authorized for use if they are found to be safe. Even though they found no safety issues during the clinical trials, CDC and other federal partners will continue to monitor the new vaccines. They watch out for serious side effects using vaccine safety monitoring systems, like the new Be Safe After Vaccination, the Health Checker app. Frontline healthcare workers and residents at long-term care facilities, plus people over 65 or with a chronic medical condition that puts them at an increased risk for severe illness from COVID-19 are currently able to receive the COVID-19 vaccine. Phase 1B includes people that are 65 years of age and older, people that are 16 years of age and older with at least one chronic medical condition. That puts them at an increased risk for severe illness from the virus that causes COVID-19, such as, but not limited to, cancer, chronic kidney disease, COPD, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, solid organ transplantations, obesity and severe obesity, with a body index of 30 kilograms or higher, pregnancy, sickle cell disease, type 2 diabetes. COVID-19 vaccines are associated with a number of side effects, but almost all of them are mild. They include pain and redness at the injection site, fatigue, headache, body aches, and even fever. Having symptoms like fever after you get a vaccine is normal and a sign that your immune system is building protection against the virus. The side effects from COVID-19 vaccination may feel like flu, but they should go away in a few days. COVID-19 vaccines are new and are still being evaluated. Some COVID-19 vaccines may prevent severe illness, while others may prevent people from getting COVID-19 altogether. Others may be effective to prevent spreading COVID-19. CDC and DSHS will keep the public informed as they learn more. You will get full protection from the vaccine usually 2 weeks after getting your second dose. It is very important to continue to be safe. Wear face coverings and social distance during this time. The Pfizer and Moderna vaccines are reporting 94 to 95% protection at 1 to 2 weeks after receiving the final dose. At this time, experts do not know how long protection will last or whether a booster shot will be necessary later after the initial recommended vaccine doses. CDC and DSHS will keep the public informed as they learn more. Yes, experts are still learning about the protection that COVID-19 vaccines provide under real-life conditions. The vaccine is not expected to be 100% effective at this time. CDC recommends that everyone continue to use all the tools to protect ourselves and others from getting and spreading the virus. Wear a mask or cloth face covering whenever you are out in public or when around people who don't live in your household. These masks or face coverings help when you can't avoid being in the same space as others. Wearing a mask or cloth face covering does not mean you don't need to stay a safe distance from others. Social distancing or staying at least 6 feet apart from others is still necessary to keep you and others safe. Experts at CDC are learning about the protection that COVID-19 vaccines provide under real-life conditions. So once you get vaccinated, keep wearing your mask, washing your hands, and staying 6 feet from others until you hear differently from CDC and DSHS. At this time, experts do not know how safe the COVID-19 vaccine is for children. People 16 years old and older are able to get the Pfizer vaccine if they are in a priority population. The Moderna vaccine is approved only for ages 18 and older. At this time, experts do not know how safe the COVID-19 vaccine is for people who are pregnant or breastfeeding. Data from studies are limited, but experts believe COVID-19 vaccines are unlikely to pose a risk to people who are pregnant. If you are pregnant and are able to get the vaccine, you may choose to get vaccinated. Discuss your options and any concerns with your healthcare provider, because infection with COVID-19 during pregnancy can be more dangerous. The CDC recommends that women in high-risk categories, healthcare workers, strongly consider getting vaccinated. There is no reason to believe the vaccine is unsafe to use in women trying to conceive. The mRNA in the vaccine does not integrate into our cell's genetic material. For more information, please visit the Bell County Health District website or call your health care provider.